interprofessional education, of those who don't understand it, it means that when more than two groups of professions get together and study or treat a patient, that's collaborative.
Right.
That is not just siloed, right? Like I'm a physical therapist, I just do my own treatment.
Right.
But if a psychologist and a PT get together, that would be interprofessional collaboration or interprofessional education. In our case here at George Fox, which we are building this robust education component for our undergrad, but also for our graduate program, because we know that this is one of the ways that we can educate our patients.
Right.
And educate our students, I should say, to make sure that we get it out, because it's a lean vehicle.
Right.
And it's not based on just tradition, right?
Right.
It's actually breaking silos.
Yeah.
And that's what I think why we're so excited about it, and that the focus should be on the person that we're meeting, right? And that's really why interprofessional education is so important. That is not about so much the process, but it's about the safety, but also understanding the patient. And I think that's one of the reasons why I'm so such an advocate, right, for IPE. And maybe you guys can speak about that, because I know you guys are a component, and I'm going to talk more about it as the future goes of GFU Talks and as my role expands. But I mean, is that important to you, right? And have you seen that also at Hopkins and Harvard or in Hawaii, like this understanding of like, breaking the silo, right? But doing it together, not just psychologists alone, not physical therapists alone, physicians alone, right? But doing it together. So.
Absolutely. Yeah. I think interprofessional approach to care is, man, I mean, it's just like 3 heads are better than one, right? Yep. Like just even in this conversation, if we're talking about a solution, we all have different lenses, right? And I think that's how I think about just like DEI on the whole. If we bring it back to like diversity education, to diversity, equity, and inclusion, is that it historically has been this perspective of like one perspective as at the head of the table and leads the ways in which we all have to now do it.
Right.
And kind of decentering that perspective and saying that is a perspective, and not to say that it needs to go away, but it is one of many. Now let's bring all of those other perspectives to the table so that we can actually understand whatever it is that we're looking at or whoever we're dealing with from a variety of angles and from a variety of perspectives and experiences. And that's what, interprofessional care really is saying like, I can bring my expertise and knowledge from a psychological perspective, also my own lived experience as a woman of color here in this area. You get to bring your knowledge and expertise as a physical therapist, as a medical provider, and we all see the same person and the same symptoms, but may have a very different take on that. And somewhere in the middle of that is the truth, right? But what has happened before is that we were all operating on multiple truths, and the person, the patient, got lost in the midst of that.
Yeah, absolutely.
And so for all of us to work together gives them an opportunity to be seen and cared for as a whole person, and not just picked apart on one little piece at a time, that then actually those puzzle pieces don't actually add up together to make a whole.
Yeah, absolutely.
Yeah.